How is a surgical biopsy for lung cancer performed? Imagine needing a small piece of lung tissue to find out if cancer is present. When less invasive methods don't give clear answers, doctors turn to surgical biopsy. This procedure helps get a larger, more accurate tissue sample for diagnosis and staging. There are two main types of surgical biopsy for lung cancer. The first is called video-assisted thoracoscopic surgery, or VATS. It's minimally invasive and involves making several tiny cuts in the chest wall. A thin, flexible tube with a camera, known as a thoracoscope, is inserted through one of these cuts. The camera sends images to a monitor, allowing the surgeon to see inside the chest. Special surgical tools are inserted through other small incisions to carefully remove a sample of lung tissue. Because the cuts are small, patients often experience less pain, have shorter hospital stays, and recover more quickly compared to traditional open surgery. The second type is an open surgical biopsy, also called a thoracotomy. This involves making a larger cut between the ribs to directly access the lung. The surgeon then removes a tissue sample from the suspicious area. Open biopsy is usually reserved for cases where VATS isn't possible, such as when the lesion is in a hard-to-reach spot or when a larger piece of lung tissue is needed for analysis. Before the procedure, you'll typically undergo a preoperative assessment, which includes blood tests and reviewing your medical history. You might be asked to stop certain medications like blood thinners and will need to fast for several hours before surgery. During the operation, you will be under general anesthesia, meaning you will be asleep and won't feel any pain. Afterward, expect some discomfort or pain, which your doctor can manage with medication. Most patients stay in the hospital for a short time for monitoring, and full recovery can take a few weeks depending on the extent of the surgery. The main reason for a surgical biopsy is when imaging tests like CT scans reveal an abnormal area in the lung that can't be safely or effectively sampled with less invasive methods. The tissue obtained is examined under a microscope by a pathologist to determine if cancer is present, what type it is, and other important details that help guide treatment. Like all surgeries, there are risks involved, including bleeding, infection, and reactions to anesthesia. There's also a small chance of a collapsed lung, called pneumothorax, or fluid buildup around the lung. However, the benefits of getting an accurate diagnosis usually outweigh these risks, especially when the results are essential for planning your care. It's very important to discuss your specific situation with your healthcare team. They can explain why a surgical biopsy is recommended, what to expect during and after the procedure, and how the results will influence your treatment options. Always follow your doctor's instructions and report any symptoms or concerns during recovery. In summary, a surgical biopsy for lung cancer is a carefully planned procedure designed to give doctors the most accurate information possible. Whether it's done through minimally invasive VATS or traditional open surgery depends on the location of the abnormality and your overall health. The goal is to obtain a precise diagnosis with the least amount of discomfort and risk, helping to guide effective treatment and support your lung health. Remember, always consult your healthcare provider for personalized advice tailored to your unique medical situation.